Very well, Andre, I understand. So I already understand that this exam, in fact, allows us to see what the patient does at night. I found it interesting. It increases my revenue. How nice. In a very integral, very honest way. And it connects you with the patient. Why? Look at what I receive. Guys, I receive a lot of messages on my social media, always complaining. To me, that they only talk about the little plate. I didn't even know there's more to do. This is a patient attending a class. Did you know that? Many times I'm here giving a class to you, the dentist, and there are patients watching me because I'm in pain. You know, when a person is in pain, they feel it and they're looking for help, answers, then they come to watch the class. But my class isn't for patients. My class is for dentists, but they watch and even comment. So look at this. I have bruxism. I have a lot of headaches that go down to my neck. I suffer a lot. I don't know what else to do. It's a patient who has already been to a dentist. Of course, she has already been to a dentist, but where are the answers? And if you're here again, congratulations. You will start to have answers for your patient. Look at this other patient. Sometimes the amount of messages I receive is enough to make you cry. I got resin veneers. I had a root canal treatment on tooth 21. The dentist didn't recommend an acrylic splint. They gave me a silicone one. I, as a layperson, didn't know. It broke my tooth. Folks, silicone splints are contraindicated for patients with bruxism. In fact, I don't use silicone splints for anything in my office, not even for whitening. Because today the level of bruxism is so high that even silicone for whitening, I've already stopped using it. Moreover, the effectiveness of whitening is greater when the splint is adapted in thin acetate. Take note of this too. Thin acetate is better for whitening. So pay attention. Patient suffering, patient with a root canal treatment received a veneer, it fractured. My question is, did it fracture to the point where they need to get an implant? Because the patient already had a root canal, right? So we don't know what the remaining structure of this patient was. We have to be careful because if a patient like this suffers a fracture and loses the tooth, extraction and implant, will she be a patient who will be okay with the dentist? Or will she be upset, sue, and ask him to pay for the implant? That's when the problems start. This could happen to you, you know. More and more patients are becoming informed. More and more patients are seeing information on the internet, chat, GPT, questions, answers. Those who have bruxism pain seek answers. And this is growing more and more. And look there, another one. There really isn't anyone who makes a diagnosis reliable. Look there. The patient's pain is, in fact, a reliable diagnosis. So, if you want to know more about these topics, start following me and share with more dentists.